Hello, everyone. I'm Dr. Bissell, the Director for the New River Health District. Today's Friday, October 2nd, and I'm going to give you a brief update on the COVID-19 situation in our area, which includes Giles, Pulaski, Montgomery, and Floyd counties, as well as the city of Radford. Many of you have written us with your COVID-19 questions and concerns. This pandemic is affecting so many people in different ways, and your questions help us understand your concerns. If you have a question, it's likely other people are wondering the same thing. So thank you for reaching out to us. We're here to share our understanding of the pandemic with you. Our answers to your questions will be posted on the nrvroadtowellness.com webpage where you submitted the questions. Let's move to the status of the pandemic in the New River Valley. We've had community transmission throughout the region since the summer. When the students returned, increasing our population by 50,000, we had an expected increase in cases in early September, which has since gone down as projected. The students shared COVID-19 within their social circles, but there's no measurable evidence that they shared it in the general community. That's great news. However, just today, we saw an increase in cases in the community. From our case investigation and contact tracing, we know this bump is from people getting together for social gatherings such as baby showers and birthdays without taking appropriate precautions. We cannot let our masks down or give in to COVID fatigue. We know how to protect ourselves and our community. Watch your distance, wear a mask, wash your hands, and don't touch your face. This week, we also felt a nip in the air. That's when our thoughts turned to two things: flu season and fall and winter holidays. We're asking everyone in the community to get a flu shot before the end of October. We already have flu A in our region, and we do not want to combine a flu epidemic with the pandemic. If you get a flu shot, even if you get the flu, your case is typically milder and shorter without the complications that can put you in the hospital. The end of October also marks the beginning of when families are planning their holiday visits and get-togethers. Many families have not seen each other since last winter, and we're being asked how they can arrange safe visits between multiple generations. The CDC has some good guidance, and we're posting a link to the questions below. Each family and person has a different level of risk to be managed. First, get a flu shot. Then, in general, if you quarantine for 2 weeks before getting together and you have no symptoms, you really don't need to get tested. If you're traveling by car, please be sure you wear your masks and wash your hands at every travel stop. It's important to keep your distance at travel stop and avoid areas of poor ventilation. You generally don't know the disease areas in the areas you're traveling through. If everybody in the family has practiced excellent pandemic hygiene, and if no one's symptomatic or had a high-risk contact, you probably don't need to wear masks in the house. You are, of course, better protected if you do. Either way, keep your distance and consider enjoying each other's company outdoors as much as possible. We encourage everybody to meet with people outside whenever they can. Wear appropriate clothing, and as long as it isn't pouring rain or snowing a blizzard, you can safely enjoy the outdoors. Remember, you can get your flu vaccine at local pharmacies or your physician's office. The health department will offer another community vaccination clinic on Wednesday, October 14th at Blacksburg High School from 9 a.m. to 2 p.m. We're also working with our local schools to offer vaccination clinics again this year. We thank you all for your help and patience as we deal with these health concerns during this pandemic. The best way to help is to stay informed, watch your distance, wear a mask, wash your hands, and don't touch your face. Thank you.